Is the FDA reliable? So the FDA was created in 1906 to prohibit the sales of contaminated food and drugs. At this time, there was a lot of food-borne illnesses due to poor practices. So the FDA needed to regulate food safety. Companies would add food preservatives to food so that you wouldn't know that they actually gone bad. The FDA actually did a lot of good things. In 1938, the Food and Drug Cosmetic Act established new drug regulations, such as testing the drug before it actually went to market. In 1960, drug manufacturers created a drug called thalidomide, which was a sedative. This drug was tested and approved in other companies and countries, but the FDA decided to do further testing on it. It turned out that this drug actually caused thousands of birth defects, and the FDA possibly many lives by blocking its approval. Today, however, we have a much different situation with the FDA. The FDA is now largely funded by pharmaceutical companies, and 1/3 of the drugs that get put on the market actually get pulled within 4 years. They only have about a 69% effectiveness rate in terms of actually approving drugs. Keep in mind that the FDA actually does not test the drugs. They leave that job up to the pharmaceutical companies. So essentially leaving that job up to the same companies who created the drug to test the drug and then report their findings to the FDA. Now this can result in massive conflict of interest. And many times drugs are given to people millions of times before they're pulled off the market. This means many people have taken it and had severe problems with it. So how did the FDA actually get started with being funded by pharmaceutical companies? So we essentially have the organization being funded by the companies that it's supposed to regulate. Well, this was the advent of user fees, which allowed drugs to be expedited and approved faster. In order for this to happen, they needed extra funding via the pharmaceutical companies. So what has this resulted in? Well, the FDA used to reject about 60% of drugs. And shortly after these fees were implemented, only about 20% were rejected. There's also a revolving door of employees where the FDA and the pharmaceutical companies, they share employees. About 30% of the FDA employees leave their job to go work at pharmaceutical companies, and the same thing happens in reverse. About 40% of the FDA members who approve drugs get paid by the pharmaceutical companies afterwards, something called post hoc payments, where the FDA gets paid about 6 months afterwards, right? So nobody notices. So essentially, bribery is taking place to get drugs approved. Now, the FDA is also responsible for food regulation. Now, there's something called GRAS, which was created in 1958, generally recognized as safe. This was created for things that we know to be safe, like salt, vinegar, things like that, so things can get approved faster. But companies eventually caught on and they found a loophole where they can approve chemicals through that same route. Well, the same nonsense takes place where the food companies themselves, they test the chemicals and then they report their findings to the FDA. And with epidemiology, you can pretty much find whatever you want, which is why soda companies find that their product never increases obesity. When you get a third-party entity who tests the same thing, they always find it, because you find what you look for in epidemiology. And of course, chemicals skyrocket in food after that, so these regulatory agencies today are clearly not doing their job, which is why we need to be the advocate of our own health, our own wellness. Power is ultimately in our hands, and we get to decide what our health looks like. Foundational principles of reality.